Hello, and welcome to this recorded presentation for the employees of KPG Healthcare. This is regarding your 2025 open enrollment benefits for health insurance, dental, vision, life, and other benefits. Quick agenda, what we're going to go over here, who's eligible, the medical programs we have available, value added programs, dental, vision, life, disability, other action items for you. Our benefit package starts on January 1st, 2025 and goes through December 31st, 2025. Our medical, dental, and vision is through Cigna, no changes there. Life and disability through Unum, no changes there. Open enrollment is the opportunity to make any changes to your policies, upgrade your plan, downgrade your plan, add or remove a dependent, select a different plan, update your personal information, verify beneficiaries. All that stuff is available to you now. After open enrollment completes, you will be locked into the plan you chose unless you have a qualifying life event. Qualifying life event is an event where you are either gain other coverage through an involuntary event or you lose other coverage through an involuntary event, such as birth, adoption, marriage, divorce, some other different situation that might happen in your life that causes you either to gain new eligibility or to lose eligibility and coverage outside of KPG Healthcare's plan. If that does happen, you are eligible to enroll in our plan in the middle of the year. You just need to report this to Human Resources within 30 days of the qualifying event. Everybody is eligible that's working 30 plus hours a week. Kids are eligible up to 26 years of age. Some key terms here just to make sure you're familiar with what we're looking at. Always good to brush up on these terms. A deductible is generally speaking the amount that the insurance company says you have to pay all of this before we start to pay anything. A copay is a fixed dollar amount, a very round number for usually for doctor visits, lab x-rays, prescription drugs. Coinsurance is the amount members pay after you meet your deductible, but before you've hit your maximum out of pocket. So coinsurance is when Cigna pays some and you pay some. Out of pocket maximum, this is the number in which once you hit this number of your out of pocket expenses, you will pay nothing else for the remainder of the calendar year for all covered services from in-network providers. In premium, this is the dollar amount you're paying for the health insurance out of your paycheck. Preventative care is very, very critical to your health. Please know that there is a $0 copay for many different benefits, many different preventative care benefits. The early detection of these things is a lifesaver, quite literally. Also saves lots and lots of money and lots of pain and heartache down the road. So make sure you are always taking advantage of your preventative care benefit. For our Arizona and California internal employees, we have the Local Plus network. This is a smaller network of providers. It is a lower cost plan and a pretty good option for those of you that are most concerned with your premium outlay on a per paycheck basis. Here's our two in-network plans. Again, California and Arizona employees only. We have our Local Plus buy-up plan with a $500 deductible and our base plan with a $2,500 deductible. You see copays for doctor visits, copays for the emergency room on this high option plan, and a relatively low out-of-pocket maximum for individuals, a little bit higher for your families, for your individuals on the base plan. And here's our per paycheck rates. Our Open Access Plus, this is your full PPO network. We have 3 plans in this in this marketplace, and all 3 of them are the national PPO plan. These are the plans that all employees, regardless of your location, are eligible for. Our 3 plans, we have a $500 deductible plan, a $1,500 deductible plan, and a $3,500 deductible plan. You'll see that the benefits are all a little bit different here across the board. Your best plan is this $500 deductible plan, also the most expensive, as you can see. The rates you're looking at on a per paycheck basis. This is after KPG management took a look at the increase, which was on average about 12%, and decided to contribute a good chunk more towards the benefits. So while the rates are going up, your employer has also increased a good amount of their contribution. Some of the benefits with Cigna, they have a really wonderful, very robust virtual care option through MD Live. You can access this MD Live benefit through your My Cigna app, either on your phone or logging in on a desktop computer. You can access primary care, you can access behavioral care, so therapy, psychiatry, urgent care. Obviously, anything with a bone sticking out of your leg is going to need to go to the emergency room, but there are lots of different benefits and medical conditions of the minor category that you can use this urgent care benefit for. Also, dermatology, a little known benefit there through MD Live. You can have dermatological visits there as well. Again, here's some ways, just some advice on how to save on your out-of-pocket expenses. Stay in network. Make sure you go to urgent care centers versus ER. Emergency rooms are the most expensive place to access care in America, so you definitely do not want to go there unless you have to. There are a lot of convenient care clinics inside supermarkets, pharmacies, and then, of course, the MD Live program we just talked about. All of these are very accessible, very cost-efficient ways to access your healthcare services. Again, in-network providers, always make sure that when you're going to a doctor or even a dentist, that you're asking, are you an in-network provider for Cigna? You can go to mycigna.com and look up these providers. When you're getting labs, make sure you're going to Quest Diagnostics or LabCorp. These are going to lower your costs. MRIs and CT scans, try to go to standalone facilities rather than outpatient hospital facilities. In a hospital setting for an MRI, CAT scan, whatever it may be, these services are going to cost a lot more at a hospital setting than it does in a standalone facility. Also, outpatient centers. So whenever you're going to get services, again, avoid the outpatient hospital setting. It is going to cost you a lot more. There's a lot of standalone in-network surgery clinics for colonoscopy, endoscopy, all these type of things that can save you a ton of money. Here is the number one thing that you can use to help support yourself to an open enrollment, the Cigna One Guide. There's your phone number, 888-806-5094. You can call this line right now and they will help answer questions on which plan is best for you. You can ask very detailed, very personal questions about things going on in your life, services that you need, and they will help you not only find the best plan for you, but help steer you into place where you can get the most cost-effective care. So in the previous slides, we talked about freestanding facilities or physicians that are embedded into supermarkets or pharmacies. This Cigna One Guide will help you find those type of services to limit your costs. Also, if you don't know where to go, if you don't know the in-network providers you can use, this is a great stop for you. For those employees that are in California and Arizona, if you're looking for that local plus the lower cost two health plans we started with, you can call the Cigna One Guide and tell them you're looking into those plans and would like to find out if the providers that you prefer are in that local plus network. Here's some more information on MyCigna. Again, the best thing you can do to improve your healthcare experience is download the MyCigna app on your smartphone. You'll have your ID cards. You can review your coverage. You can look up claims. You can schedule doctor visits. You can find in-network providers. You can manage your prescriptions. All kinds of stuff that can improve your experience, make using your health plan easier and cheaper. A lot of really great emotional well-being resources, whether it's work-life balance, whether it's legal services, financial services, identity theft. There is live chat and unlimited telephone counseling, and even 3 face-to-face visits with a licensed behavioral health provider through the EAP plan. So this is a really great place to start your healthcare journey, or your mental health journey. If you don't know where to start, again, the MyCigna app is where you can start this process. If you're looking to have a baby, they've got a really great program called Cigna Healthy Babies. It's no additional cost and helps work through your pregnancy journey, keeping you and your baby healthy. A lot of lifestyle management programs, weight management, tobacco cessation, stress reduction programs, telephone coaching, online coaching, all of it is available to you. So please take advantage. Healthy rewards program. So if you are if you're going to the gym, if you're taking care of your health, there is discounts available. There's a lot of really great programs available through the Cigna Healthy Rewards program. Again, you can find this through your My Cigna app. If you have diabetes, type 2 diabetes and heart disease, this Omada is a great program to help you manage your life, teach you healthy habits. It's no additional cost, and it is a program that you can be enrolled in if you are at risk for type 2 diabetes or heart disease. Really great program to help you with your journey through that. Another added value, identity force. Again, you're having any identity theft issues, there is this identity force benefit that is available to you. Again, the mobile apps, we got My Cigna. This is ID cards, claims, finding doctors, looking up prescription drugs, what's covered, health incentives. Okay. The well-being mobile app. This is where you can get tips and recipes, resources, wellness tools, telehealth, employee assistance program. And then the Envoy mobile app. This is more of a global app benefit where you can manage your claims and search providers internationally. If you want to look up Find a Doctor, go to Cigna.com. At the very top, you're going to find this Find a Doctor benefit there. You'll click that. You look up a doctor either by name, address, city, doctor type, whatever it may be. And this is where you can find providers that are in your network. Prescription drugs are getting more and more and more expensive. If you have a regular prescription drug you're taking, I highly encourage you to look into the home delivery system. You're going to get a 90-day supply for the price of 60 days. All right. So really, really great service, automatic refills, no cost for shipping. Really great way to save you time and money, especially if you are taking consistent prescription drugs every single month. Oop. There is the only real new thing happening here with Cigna. They are now having a new prescription drug benefit called Member Choice. This is where you're going to have either one of two anchor networks. So if you prefer CVS, you will have CVS as your anchor network. If you prefer Walgreens, Walgreens will be your preferred network. If you have not used your prescription drug benefit, if you do not have a preference, you will be automatically assigned to CVS. CVS is where Cigna has negotiated the lowest costs. This is where you're going to find your most affordable medications. So CVS is where they are really funneling most everybody to. If you're using Costco or you're using some other pharmacy that's working for you, you can still do that. But this is their new process of kind of directing people to their preferred pharmacy, which is CVS. Also, Walgreens has been a preferred pharmacy theirs for many years. So if that is who you're using, Walgreens, you can keep using that. If you are having regular prescription drugs, none of this is going to impact you. Some FAQs, it's just going to I'll just leave this on the screen so you can see some of these FAQs about the new member choice network. Again, CVS is their preferred anchor pharmacy. Can you change your assigned network? Absolutely. You go to My Cigna, you can call into the member services line, and they will help you with that. So we have HMO dental coverage, which is only available for our Arizona employees. This is very, very inexpensive. It's a low-cost way to access care. The drawback of HMO dental plans is you don't have as many providers to choose from, okay? And sometimes it can feel like an upsell environment when you're in there. So make sure that you're asking them for a scope of care, a scope of work, so you can see what they're trying to do and how much it's going to cost you before they go into your mouth and start digging around and doing some of these things. So that's for Arizona only employees. We have our PPO dental benefit that is available for all employees with KPG. PPO dental plans are fantastic because they give you great benefits and a very, very large group of providers to choose from, but it does cost more. Okay. So this is what you're looking at when you're talking about your dental benefits. Again, here's some Resources to help you find care and costs, find dentist, plan, and budget. You can look at My Cigna on the app or the website to find care and costs. There's an oral health program. So for any of you that are pregnant, have heart disease, stroke, diabetes, kidney disease, organ transplants, any of the conditions listed on there, you can sign up for an oral health program, and you have some enhanced benefits and reimbursements for out-of-pocket costs for certain dental treatments. Again, a lot of your health in your body starts in your mouth, and so this oral health integration program is very important for anybody that's got some of these conditions, any one of these conditions listed on the right. We have one vision plan. It's available for everybody. It is good throughout the country. Just kind of, there's a lot of information on the left here. I wanted to highlight your eye exam is $10. Once a year, you get that benefit. Lenses, you have a $25 copay once a year. And frames, you have a $100 allowance once every year. Lots of different providers, over 24,000 independent providers, a lot of retail providers such as LensCrafters, Pearl Vision, Target, Costco, Walmart, okay, online retailers as well. So lots of different vision providers for you. With Unum, we have renewing benefits, and we have some new ones as well. So with Unum, they are a huge provider of disability, life insurance, and other benefits. Lots of availability for help if you need them. Okay, we have our term life and accidental death and dismemberment. So every full-time internal employee gets a $25,000 benefit. This is paid for by the employer, so that's great. You also have ability to enroll in additional voluntary term life. You can elect up to $500,000. For those of you that are brand new to KPG and this is your first opportunity to enroll in any benefits, you have a guaranteed issue amount of up to $70,000. No questions asked. However, if you have already been through open enrollment or you have already been through your ability to choose or not choose life insurance, this guaranteed issue benefit of up to $70,000 is a one-time opportunity. If this is your second time through open enrollment or you've already done this and this is you want to now add voluntary life, you are welcome to do so, but it will come with a health questionnaire for you to complete. You will do this via email. So you can apply for the coverage on the iSolved enrollment portal, but if you have already been through this process before at least one time and you are electing voluntary term life, you will be asked to fill out a health questionnaire. We have short-term disability for employees outside of California. Why outside of California? Well, because California has their own short-term disability benefit, and this particular benefit is made to be equitable through all employees. So even if you're not in California, you do have a short-term benefit. Okay. So it can last up to 52 weeks. It can be up to $1,357 of your for a weekly benefit. It's a matter of 60% of your income today. When you go on disability, you get 60% of what you were making up to $1,357 a week. We have long-term disability insurance also available for everybody. Monthly benefit is up to $13,000. Again, this is based on a percentage of your income. So it's 60% of your income, not to exceed $13,000. And this would go for all the way up to normal Social Security retirement age. So you could have this for 10, 15, 20 years. If you were disabled in your 30s, you could have it all the way into your 60s. New coverage, we have an accident insurance benefit, which is available. So this is kind of just a voluntary benefit. You would pay 100% of the cost, but what it does cover, it covers broken bones, burns, dislocations, emergency dental, physical therapy, all kinds of stuff. So if you have an accident, you end up in the emergency room, you're going to get a benefit of, depending on what you choose, up to $1,000 potentially to reimburse you for what your deductible was charging you or emergency room cost. So if you are someone that snowboards, if you are mountain biking, if you are a very active person, these accident policies are great. Also, if you have kids in sports, these accident policies can be very helpful. Critical illness. So if we have Any serious illness, including heart attack, end-stage renal failure, major organ failure, transplant, stroke, cancer. There is a lot of different critical illnesses that we could potentially incur or have, and this is a great benefit. If you have cancer that runs in your family, if you're concerned about something going on in your life, this is a great benefit to select as well. Hospital insurance. We have some plans that have some high deductibles. This is a really great benefit for you guys to consider. If you end up in the hospital, you're going to get $1,000 coverage. You're going to get also $100 a day for being an inpatient hospital person. So really great benefit for any of you that are concerned with these deductibles that we have. Maybe you're choosing that $1,500 or that $3,500 deductible plan, and you're concerned that this is a high out-of-pocket expense should you have a hospital stay. This is what this hospital insurance benefit is for, so it can make up some of that gap. So this is kind of like Aflac, really. Unum is a more reputable company than Aflac, but if you've seen the Aflac commercials where they say this can help you cover part of the expenses that insurance doesn't cover, that's exactly what this is. So these are the different phone numbers and online links for members. If you need to file a claim, if you have an issue with any of your claims, this would be the phone numbers and the resources for you to reach out to. Some of the value-added services, they also have an EAP program through Unum: stress, depression, anxiety, work-life balance, relationship issues, addiction, eating disorders, mental illness, even elder care. So lots of really great things that are with this EAP program as well. Kind of duplicative of the Cigna plan, but it is there. Also, travel assistance when you are out of the country. If you need help finding qualified medical providers, you can do this. Covers anybody in the family when traveling 100 miles from home. So really great, great option here. There's also a wellness benefit. So if you are taking on any of those other, the critical illness, accident, hospital plans, there is some cash benefits for going through your preventative care visits. So if you are enrolled in any of those plans, you can get up to $150 reimbursed to you, which is really nice. So action items for you. We are going to decide if you're going to enroll or decline benefits. Everybody must do something. You should spend some time researching your providers to confirm their network. If you do not wish to have coverage, you still need to log in and waive. And everybody must log in through iSolved and complete and submit their online enrollment, whether you want to enroll or not. So thank you guys very much for staying attuned to this presentation. If you have any questions that you'd like to direct to your HR team, Gladys is available to you. Or my name is Bill Hammett. I am very happy to be of assistance to you. Please email me and we'll find a time to get together and discuss any questions you have. Thank you so much for your time here. I appreciate it, and take care.